Hi friends, in this series of fluid therapy, today I will talk about the drop rate in IV drip or rate of infusion. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided here is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand, company, or product. As we know that most of the IV fluids they are administered through IV sets or micro drip sets, but at some places, especially the secondary and tertiary care center, infusion pumps and calibrated chambers are used as they provide more precise control, but drawback is that they are more expensive. So here in peripheral setup, how we have to calculate the infusion rate, I will talk in this video. We usually follow rule of 10 or rule of 4. Rule of 10 is the simple and the best method. Here we can calculate the total amount of fluid to be infused in 24 hours. We have to divide it by 10, then we will get hourly rate of the infusion, and we have to divide this hourly rate by 60, then we will get minute by minute rate. Just remember that 15 drops in a drip sets is equal to 1 ml for routine IV sets. Whatever routine IV sets we use, 15 drops are usually equivalent to 1 ml. So to calculate drop rate from fluid volume to be infused in 24 hours, just multiply the fluid volume in liters by 10. This will be the result will be the drop rate per minute. For example, if we want to infuse 2 liters in 24 hours, just multiply 2 into 10, we will get 20 drops per minute. Similarly, from drop rate we can calculate the fluid volume in 24 hours. Here the reverse of rule of 10 is used. We have to divide the drop rate per minute by 10, and this will give us the amount of fluid which will be transfused or infused in 24 hours. For example, if we are giving a fluid at the rate of 20 drops per minute, just divide 20 by 10, we get 2 liters. So with drop rates we can calculate the amount of fluid to be transfused or infused, and with whatever fluid we have to transfuse in 24 hours, just multiply that volume with 10, we will get the drop rate. Similarly, from fluid volume to be infused in 1 hour, calculation of drop rate per minute. Here we use, if we have to calculate fluid volume to be infused in 1 hour, then we have to calculate the drop rate per minute. Here we use rule of 4 for 1 hour only. For 24 hours we use rule of 10. For 1 hour we use rule of 4. Here we have to divide the fluid volume in ml by 4. So result is the drop rate per minute. For example, if we have to infuse 60 ml in 1 hour, then we have to divide it by 4. We will get 16 divided by 5, 15 drops per minute. And similarly, from the drop rate of the infusion, we can calculate the fluid volume in hour. Here the reverse of the rule of 4 is used. We have to multiply drop rate per minute by 4. The resultant will be the fluid volume in ml which will be transfused in 1 hour. For example, 10 drops per minute. Here we multiply 10 into 4, we get 40 ml per hour. Similarly, other useful calculation for fluid therapy are, we can get perfect methods to calculate fluid volume from drop rate in 24 hours. For example, drop rate into 96, we will get the volume in ml per 24 hour. If if we are giving any fluid at the rate of 10 drops per minute, just multiply it with 96. We will be here we will be able to find out that what amount can be given in 24 hours. So it will be 960 ml. Similarly, if we are giving 26 drops per minute, uh, and we have to calculate how much fluid we can give at this rate in 24 hours. Just multiply 20 with 96, we will get 1.920 ml in 24 hours, that is approximately 2 liters. And drop rate calculation for any parameter, if we have to use, just in the volume to be infused in ml is equal to drop rate per minute divided by duration of infusion into 4. For example, if we want to infuse 660 ml in 3 hours, just divide the volume to be infused, that is 660, and we have to infuse in 3 hours. Multiply 3 into 4 and divide it by 660, we will get 55 drops per minute. In micro drip IV, in micro drip, just remember, in micro drip set 1 ml is 60 drops. Here, actually the things have been overridden in this slide. Just remember, in micro drip IV set 1 ml is equal to 60 drops. In normal IV set 1 ml is equal to 15 drops. To summarizing the fluid therapy, whatever we have discussed in my previous video, the 5% dextrose, it provides fluid and calories without electrolytes. It is the best agent for correction of intracellular dehydration and maintenance fluid therapy. Isotonic saline, it is the best agent to treat shock and salt depletion. 5% dextrose and half normal saline, it is suitable for pediatric patient. Gentle correction of the hypernatremia, post-operative and maintenance fluid therapy. DNS is good for salt depletion with calorie supply. Ringer lactate is most physiological glucose-free fluid. It is useful in diarrhea, diabetic, surgical, and burns patient. Similarly, isolite M, it is the best agent to provide potassium, and it is used as an ideal fluid in maintenance fluid therapy or parenteral fluid therapy. Isolate G, it is the only fluid to correct the metabolic alkalosis, and it is used to replace fluid loss due to vomiting or continuous nasogastric aspiration. Isolate P, it provides less electrolytes, half of the isolate M, and provides more water, so useful chiefly in pediatric patients. Isolate E corrects all extracellular fluid electrolytes, acidosis, and supplies glucose, so it is useful in treatment of diarrhea and hospitalized patient on long-term fluid therapy. So most physiological fluid is the ringer lactate. The fluid which is rich in sodium is isotonic saline or DNS. Fluid rich in chloride is isotonic saline DNS isolate G. Fluid rich in potassium is isolate M, P, and G. Fluid which corrects acidosis is ringer lactate, isolate E, P, and M. The fluid which corrects alkalosis is isolate G. The fluid to be used with caution in renal failure is ringer lactate, isolate M, P, G, and E. Fluid should be avoided in liver failure is ringer lactate and isolate G. Glucose-free fluid is isotonic saline, ringer lactate. Sodium-free fluid is 5%, 10%, 20%, and 25% dextrose. Potassium-free fluid is isotonic saline, DNS, and dextrose fluids. So, for fluid infusion, just remember 15 drops in for normal IV set, 15 drops is equal to 1 ml. Remember the rule of 10 for fluid calculation for 24 hour. IV fluid in liter divided by 24 hour into 10, we will get drop rate per minute. Drop rate per minute divided by 10, we get IV fluid in 24 hour. Rule of 4 for fluid collection for 1 hour. Volume in ml divided by R. Volume in ml per hour divided by 4, we get drop rate per minute. Similarly, drop rate per minute into 4, we get volume in ml per hour. This I have already discussed in previous slides. So drop rate calculation for any parameter is volume to be infused in ml divided by duration of infusion in hour multiplied by 4, we get drop rate per minute. For micro drip or micro IV sets, just remember 1 ml is equal to 60 drops and number of micro drops per minute is equal to volume in ml per hour. Benjamin Franklin has said the best doctors give the least medicines. With this, I conclude the my topics on fluid therapy. I hope you have enjoyed this video series. I will come with another topic in my next videos. Keep learning. Thank you.